As a multi-employer plan, can new employers group join without ceasing being a grandfather plan?
So a MIWA, of course, in the state of Kansas has to be fully insured. Could you join that and not cause your grandfather status to cease? It kind of is along the line of the question before, because we don't know if a change in carriers, you may be changing carriers if you join a MIWA. You're very likely changing benefits. To what degree are those benefits changing? And what is the clarification yet to be issued going to say? So unfortunately, it doesn't have a clear answer today.
Just a couple more questions that we have. In 2014, for the requirement of companies offering minimum essential coverage, is this at no cost to the employee?
Right. In 2014, as an employer, if you're a large employer, 50 employees or more full-time equivalent, you do have to provide that minimum essential coverage to your employees, or if you don't, then they can go to the exchange, and if they qualify, you'll be subject to the penalty. Now, Congress had some forethought there, and they said employers are also prohibited from adjusting employee salaries to offset this insurance cost. There isn't really any penalty built in, but it says if the Secretary of Health and Human Services comes to believe that that's happening, that the department is authorized to look into it and do something bad. So
now, Terry, providing those essential and minimum levels of coverage, I think the question also included, do they have to cover the premium cost in its entirety for that? I think is what they were asking as well.
Right. Is this at no cost to the
employer? At no
employer?
cost to the employee.
Employee.
So does the statute address the premium cost or simply the plan design elements?
It's more along the lines of what has to be in the gold, silver, bronze, and platinum plans, and what has to happen. And the driving force is always the employee. If they opt out of your plan, then you have to give them a voucher saying, okay, we would have paid you X amount, and you can take this voucher and go over to the insurance exchange. And if they go over there and it turns out they're eligible for that tax credit, then the employer gets hit with a penalty. So employers are going to have to do that balancing test where they hit that point where employees are getting good enough coverage that they don't opt out and go to the exchange, subjecting the employer to a potential penalty.
Okay, one more question. If an adult child under age 26 is not considered a dependent for tax purposes by the IRS, must they still be covered for insurance under the new provisions? And, if so, is there imputed compensation to the employee that must be reported to the IRS?
Who did that come from at that back table back there? I told him what goes around comes around. So to my knowledge, and I'll be honest, I didn't specifically look into it, but I don't believe the IRS, this doesn't change the IRS's position of what a dependent is. So the IRS still has a clear definition of what a dependent is, that the fact that now under health insurance they can go up to 26 or 26 years old isn't going to change that. The question then is about imputed income. No research at all. My initial reaction is no. I don't believe there would be any. Because, I mean, these are parents. You know, the children are on their health insurance, but they're providing. You know, I guess I see they are providing some benefit for them, but I don't believe that would be income among parents and children. So, without any research, that's my reaction, I guess. And I'll find out who asked that question back there.
Let's thank our panelists with our applause. I want to remind you, our panelists are Karen Vines from IMA of Kansas. We have Clinton Baker from Kennedy and Coe, and also Terry Mann from Martin Pringle. They are great resources for you as you go through this, and we hope the Business Journal is going to be a good resource for you as well. I'm sure they would encourage you, if you have questions beyond this, to give them a call. And if you have questions, some issues that you'd like to see covered in the Business Journal, we also would appreciate your call. We want to serve as that resource for you as you move through this very complicated issue. So thank you very much for being here. Have a great week, and hopefully we'll see you next time. Thank you.